what happens with them? Obviously, they're not reproducing in the same way, but...
The male menopause is a bit of a misnomer, that a lot of men round about 50s, 60s have identity crises. They're getting older, people around them are getting older, that makes them feel anxious, the anxiety makes them feel a bit hot and sweaty. So for most of them there's no hormonal basis in it. But men can suffer from a reduction in testosterone levels, and that can affect their libido, and it can make them have hot sweats, and that can give them symptoms very similar to the female menopause. But it's very rare, and it's much less common than you would think it is, and it's certainly much less common than the female menopause. I think if you're a man and you are having symptoms, you're having flushes, you're feeling unwell, possibly having sexual problems, I think it's worth talking to your GP about it. There's lots of other causes other than reduced testosterone, as I said, you know, anxiety, depression, diabetes, that causes reduced sexual function. So, you know, it probably is important to get some blood tests done. And one of those blood tests could include a testosterone measurement. And if that was found to be low, your GP would ask a specialist for advice about what to do with supplementation, because it's not mainstream treatment.
Why not?
It's not mainstream treatment, I think, because there isn't a lot of... it's not as easy as just taking a testosterone tablet. There are also risks involved with taking testosterone too much, will cause you to be very aggressive, which is not really going to do you much much good if you're having relationship issues. So I think it is probably something that's best left to the specialist.